There, welcome to Simulation Pulse Live, February 7th, 2025. I'm Jon Brouchoud, co-founder and CEO of Arch Virtual, and we're the developers of the Acadicus platform. And we have Rick Castille, our customer experience specialist today.
Hey, everybody.
We'll see if anybody else joins today for our open office hours, and if there's anything we want to talk about or cover.
Last week, we had a great show where we had one of our clients who walked us around their 4-bay unit. And it's just so exciting to see, when customers get inspired and create and use the platform to do something unique and useful for their particular organization. It's just always mind-blowing. I mean, you see things that you never thought about doing yourself, which is always inspirational.
Absolutely. I couldn't agree more. It's one of my favorite things about it is that it's this sort of like living organic thing that is sort of self-defining in a way. It's like we're just providing the tools and then we get out of the way and we let our customers do these interesting things that might be surprising or unexpected use cases that we wouldn't have imagined if we tried to hard code that into the program, but we left it flexible enough for them to be able to do these wonderful things. And in that way, it re-inspires me every time I get to see some of those amazing creations and some of the exciting, and you can tell the people that are presenting it are excited that it's helping them advance their careers and feel good about the work they're doing. And um, so it's really cool. Here comes Bill Ballo.
Hello, gentlemen. How are we today?
Doing well. Happy Friday.
Happy Friday.
Another thing that's out there, and we have to get Dr. Slaman on, is he's been posting a lot. This is his post on LinkedIn, and he's very excited about the ECMO process that we were able to create alongside him that he's using at DuPont. And we really need to get him on and have him
Yes, we do.
show us all the intricacies that he, again, helped design to train and teach the use of ECMO here in VR.
Yeah, and Dr. Slaman is a great follow on LinkedIn, like you're showing right here. If you go to his page, you can follow him, and he posts things about his use of Acadicus and virtual reality and simulation often. And it's just really cool to see the work he's doing. As a practicing physician, he's in the field and he's building simulations that are helping him solve real world problems that he's experiencing in his practice and using this technology to help advance and to solve those problems. And I think it's cool insofar as he's able to do that, from his own computer. He's not, he identifies a challenge or a gap or an opportunity, and then he's able to go into Acadicus and he's able to develop some kind of content or simulation or 3D recording or step-by-step demonstration on his own without any programmers. There's no programmers helping him do that. He's doing that all by himself. And then and deliver that. And I see my video looks like it's frozen now.
Yeah, but your voice is coming through.
Let's restart it and see what happens. Cannot start video. Failed to start the video. Well, I don't look very great anyway, so you'll just have to listen to my buttery voice. But I finished my point on that. But I just think it's cool that he's able to do that. He doesn't have to go down to the simulation lab. There's nothing wrong with the simulation lab. Simulation labs are great. The mannequins are awesome. We're not dissing on that. But in this case, it's Dr. Slaman by himself and, able to go and create these simulations and bring his residents and fellows through like on the floor of the hospital instead of going somewhere else and trying to coordinate. Okay, everybody, like next Friday at 10 a.m., let's all go to this place. And everybody's busy and frantic and they got more patients than they can handle probably already. And now there's another thing they have to put on their calendar, whereas this is just, when you have a chance, come on in, we'll run through a simulation. It'll help prepare you for, this one particular situation that we'd like you to be ready for. And I think that's great.
Yeah, I agree. My dog agrees too. She wants to get up here, but I think that's the benefit is that you don't, you can just kind of go in and create. It's a lot of fun too,
Oh, John, you're back.
I'm back. Did you miss me?
But, it's also, I think, really impressive that you can take something, and I honestly, off the top of my head, can't think of a more complicated process to have to describe than ECMO. I mean, this machine that's kind of cycling the blood out of one area of the body back into that's really, really complicated stuff. And the fact that you're able to do that without having to have the equipment there, which is expensive, and using um, uh, disposable stuff that you're going to have to spend money on and get everybody into a physical space. I mean, all of that's difficult. Now, this is repeatable, however, and whenever he wants to spin it up.
Absolutely. And I should be clear, in the case of the ECMO simulation, we actually did build that content for him. That wasn't something that he was able to go and do and build on that level. There's different levels of content creation in Acadicus, and we've talked about this in past episodes. But if you're using content that's already in our library that Acadicus comes with, every subscriber has access to that entire library. There's hundreds, probably thousands at this point, of assets. You can build just about anything that you want, but ECMO is a very specific process. And so when Dr. Slaman, Dr. Kalbach, and his team wanted to create a simulation to help teach this, there were some specific pieces of equipment and some specific functionality that we didn't have yet. And so our Acadicus Assist program allows an organization like Nemours DuPont to be able to sponsor the development of that content. And we develop that content at a loss to us financially. We basically build it at our cost or below our cost, in exchange for the opportunity to share that content with other users. And so this is kind of a little bit of an innovation twist in our business model. It's a little bit unlike what you see in any other software out there, that you have this double benefit of you subscribe to Acadicus, but what you're getting day one is nothing like what you'll have, in the last day of your first year of your subscription. There's going to be a whole bunch of new content in there, and there's new functionality that we're building with guidance from literally the world's top experts in each of these things. We're talking about experts in the field practicing that are telling us exactly what they need this piece of content to do. And then we're building it at their direction. We're going through feedback and revisions and getting it just right. And then usually we have the opportunity where they'll implement that. They'll measure the results. They'll have the users take surveys. They'll gather some data on the efficacy of how well that simulation is working. And in a perfect world, they publish that data, and the rest of the simulation community gets to benefit from seeing the work that they're doing. So that's kind of the full loop beginning to end of what we're looking for. But if you want to run a simulation and you don't need to build custom content necessarily, you can just go in, use the library, create a simulation. And we've seen certainly Dr. Slaman and other customers do that on many occasions. So best of both worlds, hopefully.
Well, and ECMO is something that we cover some when we're talking about critical care transport in EMS. Now, usually if we're talking about a critical care team that's transporting a patient that's on ECMO, something like that, we're talking about, physicians, nurses, paramedics that will all be working together in that. So the education that you can get regarding ECMO from a person like Dr. Slaman can be beneficial to your program, not just as physicians, but also in nursing, and in critical care EMS. So these are things that work across, across fields. And we've talked about it for a long time. Oh, we need to break down the barriers between the fields and all of that. And this just lends to that possibility. I mean, just listening, if Dr. Slaman goes in, does a 3D recording, and then you want to take that 3D recording and make that part of your, obviously with his permission, but make that part of your critical care teachings or something like that, that can be extremely useful. And that's a that you wouldn't have previously. Not only, it's great to watch videos. Oh yeah, well, there's a video out there about this, or there's a video out there about that. Yeah, that's great. But to actually have someone like Dr. Slaman explaining ECMO, and then go in there and watch a 3D recording, being right where he is and experiencing what what he's showing, looking at it from any angle that you choose, highly valuable, highly valuable, highly memorable. So we don't get to learn from enough professionals, and I think that's extremely valuable.
We do
Absolutely.
have somebody in our waiting room here, John. Deanna?
Oh, Deanna Edgar, welcome. I can
Thank
allow
you.
you to talk if you want at any point, or you could just use chat if you have any questions for us. This is our open office hours. We do this Friday at noon every Friday, and we're here to just answer questions or talk about some of the content that we're releasing or go over some of the features or anything like that. So appreciate you joining us, and let us know if you have any questions as we go.
Yeah, Deanna, if there's anything specifically you want to know about Acadicus, well, we're the crew. We could probably tell you a thing or two.
Yeah, we had a
So
great guest last week. We had I'll be editing that video and we'll be putting that out there, and there's a bunch of videos that are going to be coming out in the next week, probably in our Simulation Pulse page on our website, past episodes and things like that. So we've had some guests come on and we've talked about, like I say, content and unboxing some of the new content and features that we've got. So we'll be showing those videos on the Pulse on our website.
this week's going to be a pretty busy week in the XR Center. I have some updates that I'm doing to Carl Shapiro, our patient that goes from congestive heart failure into cardiac arrest. Because we have that ability to now have a slideshow in Acadicus, now I can take the the EMR directly from our nursing program, and this is what they use for their mannequin simulation. I can now put that right into Acadicus and use that the same way they use it. So Monday for me is updating Carl Shapiro. I'm going to have some visitors coming to the XR Center talking EMS, and what things can we do. Um, I'm still not giving up on you, paramedics. I know you're out there. So, and then uh, I'm going to Goodman South on Wednesday. We'll be leading with our LPN students. We'll be using the birthing simulator. This is the now second semester that we've been using the birthing simulator in a lecture, not in necessarily in simulation. It's more in lecture. So this instructor is gonna it wants to do a lecture on do theory class on how do we treat birthing patients, those kind of things. And so we actually start off by having them witness a childbirth, and it's kind of fun because you just throw them into the deep end of the pool and you go, all right, here we go, baby's coming, what are you going to do, right? And that makes it a really memorable experience, and then that allows them to have something to tie back to that theory course, right? So now they can take that experience that they've had and they can tie that back to when she's talking about certain things in theory course, and that helps immensely. And then we're starting training for our new hires in the XR Center.
Excellent.
Two new hires that are in the XR Center. One comes to us um, from simulation, and then the other is actually a former student of mine, but also just an all-star when it comes to all things EMS and nursing. And she has actually been through Acadicus as part of her class. So, it's kind of like you're taking that person that had that experience and bringing them in, and she like the level of excitement is really awesome to see. Because obviously I hope that students enjoy it when they're done, but the level of excitement is excellent. So we've got some great stuff going on. I really, really like that more instructors are starting to incorporate virtual reality into the theory courses. I think that's going to make a big, big impact on your theory course. Instead of just you have the PowerPoint and stuff like that. I mean, if you think about PowerPoint, right, we really never left the overhead projector. Okay, like that's the PowerPoint is a newer form of overhead projector. Yeah, you can add some cool multimedia to it and stuff like that. But we really never left that. And I think this is one of the biggest strides that we're making in lecture in really a long time. I know there are other people out there doing it. I know it's happening around the country. I know there are people doing this, but I just think it's really cool to finally see that coming to fruition. So. And it's not just me doing it. It's not like I'm going, okay, I'm going to do a little lecture on the heart or something like that. It's now my instructors as well. So there's a lot of planning that goes on behind that, and it's nice to see it happening. So
That's super cool. I love that use case, and I love the idea that, you're sort of leveling up that PowerPoint where you're like a static observer, as a passive observer of static content, right? Like you don't engage, and in this way you still are watching a simulation. You're watching someone else interacting in a virtual world, but it's real time and dynamic, so that you're seeing the things that are responding and changing in real time, but you're also looking at a place that you can go.
mhm.
So when the didactic element of it is completed, you essentially there's a place you can go. It's not just like a PowerPoint. When it's done, it's over. But after the end of the simulation, if you now want to put on a headset and go into that room and complete that exact same experience in an immersive, fully embodied way, alongside others, alongside experts that could be joining from other locations, other students working together, so it's like a PowerPoint you can step inside of and like become part of and interact with. So there's that full spectrum, and I love that we're seeing that integrated into that didactic portion of the learning experience.
Yeah. Yeah, and because of it, actually, the instructor she and I have been talking about it for probably a little over a year, maybe more. And then some family stuff, and she had to kind of put it on hold, and then she came back to it. And now like full force. But what's great about it too is then, I'm at Goodman South next week doing it. Well, the very next week after that, I'm at Fort Atkinson with another instructor. So, it's catching fire, right? It's continuing from one instructor to another, and that wasn't even me doing that. There's been so much of me sort of facilitating these things, and I've almost felt in a little way like I'm kind of forcing some of it. And I don't like to feel that way, but the instructors have been really receptive, so I don't think there's been a lot of forcing. They've been really receptive. But I think what's really great is now you've got one instructor talks to another instructor and says, "Well, I do this in virtual reality." And the other instructor goes, "Really?" And even students talk to other students. Well, my instructor uses virtual reality, and they're like, "Wait, my instructor doesn't do that." So that kind of helps to get that grassroots movement moving. I think it's much personally, I think it's much better if it comes from the bottom up than it does from the top down.
Agreed.
I'd much rather stand back and say, "Hey, let's make these things happen. I'll facilitate in any way, shape, or form I can, but y'all start to talk to each other." And I go to their meetings and I go to some of their get-togethers and stuff like that and make sure that I make my presence known. But forcing someone into doing something they don't want to do, not going to work. But if you let them see somebody else doing it and they come over and they go, "Oh, hey, that's a really great idea," and that's exactly what's happened with this birthing experience in didactic, and so it's great. It just it makes for a better experience for the students.
That's awesome. And I think there too, it's really cool that like one piece of content that we have, the birthing simulator, which was a collaborative experience with a lot of different people sort of working together to create that content and make sure that it's accurate in every way that as much as possible. And so the alternative to doing this kind of teaching is to like really take like a physical mannequin, a birthing mannequin, and like haul it to these remote, because you're talking about remote campus locations, right? So
Right.
Madison is one of them, and then there's these remote college campuses that are part of Madison College that are Madison College that are just in different locations. So they can't, it's impractical, it's impossible to ask them all to drive an hour and a half every time they need to come into the main campus where the simulation lab is and run these simulations with a birthing mannequin. But in virtual reality, you can do that because it's like one piece of content that's accessible in many, many ways. It's sort of like, and similarly, again, it being a place you're going into, what I love is that idea that eventually those instructors will be able to put on a headset and be together in the same virtual simulation lab, talking to each other, interacting with each other, teaching each other's students potentially, running multifactorial simulations with all different actors that are involved with it. There's so much possibility for growth. And I see this as like the early stages where it's germinating. We're seeing these things starting to happen, and but the depth is already ready. It's there for them when they're ready, and I think that's where we're really going to see some really hyper accelerated growth in access to simulation where it hasn't otherwise been accessible. And it's all there it's ready to go. So it's exciting to see this all getting started.
Yeah, and it's part of the requirement of the accreditation, right? That if you're going to offer that class at a satellite location, that the offerings have to be the same. You can't at one location say, okay, well, we're going to do all this really great complex simulation, and then at another location go, well, you're not going to get that. It doesn't work that way. So, it has to pass on from one place to another. And essentially what's happened, I mean, Reedsburg from our main campus, Reedsburg's an hour and a half, depending on the traffic. Watertown is about 45 minutes. I mean, these are not short drives if you're carting around this big mannequin. So there's a lot to it. And I go out there with my four laptops in a wagon. I have a little blue wagon and I carry four laptops in four bags, and four headsets are in those bags, and I just carry them all in. I set them up. It takes me 30 minutes maybe to set it up. If it's in areas where I'm already working, like Watertown or Reedsburg, well, I have my computers there already. That's done. So I just go out to that location and I help facilitate it. And eventually, because I will have these new hires, I can say to one of my partners, hey, you work on site, I'll work from here, or I'll work from the XR center, and I'll facilitate the simulation. You facilitate the getting everybody in the headsets and those kind of things. And so it makes life a lot easier. It decreases the amount of funding, the amount of money that you have to have in order to, like, it's not cheap to drive these trucks around with these big mannequins in them. So it can decrease, and she lives in Watertown, so all she's got to do is go from her house to campus, and that's it. And that's my dream too, is just to have one person that covers each of the satellite campuses that we work at. I can work from the XR Center. I can work from here, wherever it may be, and help facilitate those. So
Absolutely. And I think that's also in service of an even higher goal that we're after. Ultimately, what we set out to achieve is this idea of accelerating or enabling the increased capacity of programs to be able to graduate students faster, more students faster, and have them retain as much or be as at the same level, without sacrificing any quality. Is there anything that we can do to accelerate the learning and to increase capacity? And obviously, access to simulations is one of those bottlenecks, because it's very expensive. And so, if we can lower the cost of that, we could ultimately, look at a world where we increase capacity and we're able to graduate more students, which is really important because of the shortage. There's a growing, desperate shortage that's going to get a lot worse. It's starting to reach a fever pitch where more people are aware of it than ever, and people are starting to go into those ERs and having to wait 8 hours to get back in there and see someone, and then they're waiting another 12 hours to get a room on the floor if they're lucky. There's shortages, and the shortages are getting really bad. So we need to solve that problem. And a lot of people that are very high quality, highly qualified professionals are reaching retirement age. So we're losing a huge part of the workforce. And yet we're also not graduating more students to accommodate that shortage. And so there's a major issue here. And I feel like it's not getting enough attention. Although I will say, I am very encouraged by the HBO series The Pit. Have either of you seen this yet? It's a
Yes.
it's an amazing show, and they're
It's very
just shining a big bright spotlight on how bad these shortages are getting and the inner workings in the hospitals that are causing these shortages or sort of like, trying desperately to solve these shortages. And what do? You're sort of caught in a situation where you have to make choices between bad and worse, and it's just an amazing series. I would highly recommend it if you haven't already. And what I'm really curious about, and I haven't looked into it yet, is if there was anyone in the simulation community involved with the creation of some of the experiences that they have in that show, because you're really looking at things that look familiar to me as a regular IMSH attendee, where you're looking at, the cadavers and the way that they do the some of the gory stuff. They do actually a tracheotomy. They do, step by step, they show the procedure in the show. And I'd be curious from your perspective, how accurate that
Yeah.
is, but I would imagine they went to some pretty great lengths to make it accurate. And I wonder if any of our favorite simulation experts that we know from our community of IMSH were involved with that, because it sure looks like simulation to me. But
Yeah, it's
great
pretty
series.
impressive.
I'll have to take a look at that. I'll have to take a look at that. So
Yeah,
Yeah.
Bill, you're gonna love it. You're gonna love
yeah,
it. And
yeah,
they also are multidisciplinary. They do show the paramedic side of things. When they're
yeah,
getting delivered, a new patient is coming in, and the paramedics are going through, their handoff, and then you're seeing the nursing perspective, you're seeing the physician's perspective, you're seeing burnout, you're seeing retirement, you're seeing all these things happening in a really interesting way. So I'm hoping that helps raise awareness of the shortage, because it's a national emergency right now, and people are just sort of, I don't know. There's a lot of people that are working very hard to try to solve it, but I think there's an awful lot of people that just aren't aware of just
yeah.
how bad it's about to get. And I really hope we can find some solutions, and I really hope that we can be a part of those solutions.
Yeah, EMS is in crisis nationwide. I mean, I think part of it is that EMS was looked at for a long time as more of a volunteer kind of thing, and like
Hmm.
volunteer firefighters, those kind of things. And oh well, there wasn't a whole lot of training. They were more or less an arm of the doctor, and they would call the doctor, and they would get all the information. That's like Johnny and Roy 1970s, 1980s stuff. It's
Hmm.
been different even since I got into EMS in the 90s. And because I still do hear from people where they're like, oh well, paramedics they don't do quite as much of it. We have a roving emergency room. I mean, essentially that's what we are. We're an emergency room on wheels. And yeah, we can always consult a doctor, which is great. But the vast majority of what we do is standing orders. The vast majority of what we do is stuff that's already within our protocols to do. And so, we're doing all of this stuff, and the knowledge base is getting bigger and bigger and bigger and bigger. And so a lot of these volunteers are like, I can't do that. I don't have time to go to EMT school and or go to paramedic school, especially because paramedic has kind of become the gold standard in EMS. It's like, that's what you're looking for. And so you get this like I don't have time to go to paramedic school. I don't have the money to go to paramedic school, those kind of things. But you have to in order to learn all of these things and in order to gain all of this knowledge. And paramedic school is only getting bigger and bigger and bigger and bigger. They're only putting more and more information into it. It's not less information. They're not taking things out of paramedic school. There's more information coming in, every year. And so, like, how do you solve that problem? How do you work on that problem? And and the push for the amount of simulation that paramedic students have to do is it's unbelievable. The amount of simulation we have to do and the amount of simulated and real patients that we have to see before we're even allowed to sit for the test is unreal. It's unreal. And they count it not just by like the patients that you see, but by the ailments that you treat. You have to see a certain amount of cardiac patients, a certain amount of respiratory patients, a certain amount of, abdominal pain patients. Like it's not just, well, you see a few patients and whatever you saw that day was great. It was a good experience. You're essentially forcing specific experiences, and you have to. You have to. So, and that's where virtual reality can really step up and help out. Because you can those patients that you don't always get to see. That was one of the reasons we developed the birthing simulator. That was one of the reasons that the first two things that I wanted in Acadicus. One, dynamic cardiology. Duh. Cardiology is my thing, you know, and it always has been. And then two was a birthing simulator. And it was all because of those that need for experiences. So
Yeah, and every so often I'll still encounter, sort of skeptics of not just VR, but simulation as a whole, where they'll sort of act like, well, these students need to interact with real world patients. Simulation isn't going to help them learn things. They have to get in the field. They have to see it. And they just sort of have this altruistic idea about what graduating from school should be like, but they're just not sensitive to the reality on the ground, right? When, and you watch a show like Pitt and you'll see, and I think they nailed that aspect of it where there's just a frantic waiting room full of people trying to get in. And, you're desperate for time. You don't have the ability. And now somebody shows up that has absolutely no experience. They're green. They haven't seen any of this in the field. And they're not even sure whether they're going to be able to tolerate being in practice, much less actually actively help you with the frantic workload that you already have. And now you have to like invite them to be a part of seeing these things happen. It just doesn't, it's impractical, and where it can happen, it's the highest possible bandwidth for sure. No doubt about it. If you could get every student to have all those experiences, wonderful. But you can't. It's impractical. So you need to be able to provide them some glimpses of what those experiences are going to be like so they can be better prepared for it in the real world.
it would
Mhm.
take it would take decades. It would take
Yeah.
decades for them to get all of the experiences that they essentially need if it was we were going to see, real world patients and treat real world patients. And
Absolutely.
I agree. Like I think before you work your first childbirth, you should see a childbirth. I think, before you deliver twins on a couch in Clearwater, you might want to, you might want to have some experience prior to that. But we can't always do that. We can't always get every single experience necessary, you know, because then you break it down to the micro too. So the macro is cardiac patients. Okay, fine. But then what about a patient with an inferior wall MI that has a different sort of like there are some different concerns that we need to think about versus a lateral wall MI, right? So we need to think about different concerns here. Is this affecting the right coronary artery? Is the patient's preload compromised, right? And so now you're breaking it down even more to the micro, from you need to see cardiac patients to you need to see this patient and this patient and this patient, because you need to know when it comes to treatment, if you start flooding that patient with nitroglycerin, uh, you're going to have a bad day.
Absolutely. Well, this was good stuff, guys. We covered a lot of ground. Unfortunately, we lost Deanna. She's probably like, John is just rambling about too many things. I got to get out of here. Doesn't know what he's talking about. I hope not.
No, I doubt that. I doubt that.
That's all good. It's nice to have somebody join us. We don't really
Yeah.
promote this because the video, like asynchronous views of the videos end up being where it's at. But then I've been just taking too long to get the videos compiled. My mistake was making it into too complicated of a process. And now it's become this thing where every episode is like hours and hours of going through AI and getting the transcripts and editing the transcripts and making sure that it didn't make any mistakes on naming the participants. And it just became this huge process. But I think what I'm going to do is get back to just simply, doing a quick pass on the video, getting it up on YouTube, putting the YouTube embedded on the page on our website, and keeping it simple. And if I've got extra time, then I'll come back in and do all the bells and whistles,
Yeah.
But I made it too complicated of a procedure, and it's all on me. I'm the only one that does it. And so it became untenable. And a little overwhelming, to be honest. So I'm gonna get back after that. We'll get some of these episodes up, but those episodes do have a long tail of viewers, and it seems weird, when we're here together, it's kind of like, oh, there's nobody watching, we could just whatever. But when you look at the views start to tick up on some of those past episodes, like we've had some that like nobody was here, but we ended up with hundreds of views.
Right.
And like if there was 100 people in a room and we were giving a presentation, we'd be all nervous.
Yeah.
like,
Yeah.
I mean, there are people watching, and the cool thing is they're watching because they found that video and they want to watch it. They're not just people that are attending some presentation where they're just, okay, what's this going to be? They're people that are actively looking for the information we're providing. So I think that's a good KPI, key performance indicator.
Yeah.
So, well, if we don't have anything else, we could wrap this episode up. What do you guys think?
Yeah,
Watch The
good.
Pit. If you aren't
Well,
already, watch The Pit. I'm
Watch
only
the,
on episode 3, but I'm savoring every episode. I'm being really
yeah.
patient with it. I watch them over. I watch the first 2 episodes twice each before I'm allowing myself to move on because it's just I'm saturating myself in it because it's so fast paced and it's so well done.
yeah.
I can't wait to hear what you think, Bill, from the perspective of a paramedic and
Yeah. I'll have to check it
seeing
out.
the
Yeah.
reality of what's
Yeah.
going on to see what you think. To me, from my experience as somebody sitting in the waiting room, I think they nailed it. Like
Yeah.
I can feel it. Like it's almost too much, where I almost don't even want to watch it because it's so realistic.
Yeah.
But the gory parts are gory, but they're so well done that even that it doesn't bother me at all. Probably because
Uh,
of all of my desensitizing and catechus.
that's all right. That's still kind of my favorite part anyway. So yeah.
Yeah, yeah.
I
I think
I still have that I still have that adrenaline for blood, guts, and gore. So yeah. I'm not even sure really where I got that from. It just I don't know. That was just a thing for me. So I was
John, we need a blood squirt asset.
there you
Yeah,
go.
yeah, 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 yeah.
Some
I
arterial bleeding, some
Yeah.
venous bleeding,
yeah, yeah, yeah.
like yeah, yeah, yeah.
I think I
Yeah,
think a lot of the yeah, go ahead, Bill.
no, that actually would be fun.
But I
Hey,
think the
check
the
this
gory
out.
parts of it like aren't as gory as they probably are in reality, but I think they walk a line between going
Mhm.
too far with it. Like if they really did an accurate representation, they would probably lose a significant portion of viewership. So I think they do a good job of walking the line. And I think that's why it reminds me so much of simulation, because simulation's like that too, where it's like you try really hard to make it look as realistic as you possibly can. But there's ultimately a limit to how much you can get
Yeah.
paper mache and flour mixed with water to like look
Yeah,
real, like you reach a point. I think they probably, could have made it a whole lot more graphic, but it seems like they did a well enough of a job to make it work with the development of the plot and the narrative, where you're not really zoned in focusing on, now wait a minute, that incision was, you're not like paying attention to that. You're paying more attention to the whole story. And oh, by the way, there's this really tricky procedure they're doing, but they just kind of show just enough of it to make you follow along and feel the connection with the patient who's undergoing that and the people who are performing the procedures. I think it works really well. I think they did a great job.
Mhm.
yeah. That has that happens quite a bit. Like in simulation, when we'll do stuff you mentioned earlier, trach or crike for us, and we teach well. We teach a couple different methods, but one of them is open crike, right? It's just a surgical crike. Basically, you're just cutting into someone's neck to insert an endotracheal tube to breathe for them. And I always tell the students when I'm showing it to them, like, don't get fooled, right? We're doing this on a fake piece of skin on a
Mhm.
piece of corrugated tubing, okay? Like this is going to be bloody. You're guaranteed to get a lot of bleeding. So have somebody standing by with a suction, right? And so that's what I always make sure that I tell them. And I really can't prepare them for it. And I had one student once come back to me and go, I did a crike the other day. I was like, oh yeah. He's like, yeah, in the field. And he goes, yeah, how was it? He goes, it was way bloodier than I expected. That was unbelievable. The amount of blood, when I finally cut in there and it's like he goes, I just didn't expect it to be that bad. And I was like, it is. It just is, and it's fine because what you're doing is you're saving a life, and that's fine, right? So you'll deal with that later, but giving the student that experience, like we talked about before, giving the student that experience and that knowledge, and seeing what it's like to see the amount of blood that we're talking about. It's a pretty significant amount. And that's if you do it right. If you do it wrong, it's worse. If you do it wrong, if you miss, that's where the real problem comes in. So if you're doing it right, you get a good amount of bleeding. you do it wrong, it's way overboard. And now you're talking about, you know, a situation where you haven't helped the patient, you've hurt them. So
Mm-hmm.
yeah,
Mm-hmm.
so you know, people that say, well, it's simulation, you can't get that same experience. I don't want to put that scalpel in the hands of a student who, you know, we're trying to save a patient at an accident scene, and I go and put that scalpel in that student's hand when they haven't gone through it in simulation.
Mm-hmm.
No way. No way would I do that. You know, how many times have you done this in simulation? Would be my question. Now, you know, I might not ask that directly on the scene, but I'd have a knowledge base as to where my student is or and what they've already performed. So yeah, no, no way would I put the scalpel in the student's hand and say, okay, now's the time. So yeah,
Mm-hmm. That exact scenario comes up in this show. That
does
exact
it?
thing about like, are you gonna do it? Are you sure? How many times have you done this? I've never done it before. Like,
Yeah.
okay, well, like I'm gonna be standing here, go for it, you know. And it's also been like a walk through memory lane of Acadicus where it's like we have breaking bad news to a patient. We've got dementia patients that haven't had their proper they have a DNR order, but the family doesn't want to honor that. And so now they're intubating a very, very elderly patient against his will, but it's technically legal, so they have to. So that we had all that in the catechus. We had there was an intubation, there was pericardial tamponade, there was
Yep.
tension pneumo, there was abdominal obstruction, there was liver. I mean, it's like pretty much everything we have in a catechus. I'm watching the whole time, like we have that in a catechus, we have that in a
Yep.
catechus. Pretty much every
Yeah.
scenario.